Good afternoon, Santa Clarita. Welcome to the Providence Holy Cross Health Hour. This is Tom Burton, the Orthopedic Program Manager for Holy Cross Medical Center, located in Mission Hills. You know, that little 355 bed hospital that's serving the northern end of the San Fernando Valley, as well as Santa Clarita Valley. Not only are we serving Santa Clarita, 30% plus of our patients are actually coming from Santa Clarita, but gosh, I'd say probably 30 to 40% of our actual employees are actually living here in Santa Clarita as well. So, we feel akin, if you will, to Santa Clarita, and really glad to be out here. The Providence name is slowly creeping its way into Santa Clarita. We're going to find it kind of all over the place, predominantly on that McBean stretchway over by Valencia, the Holy Cross building, as well as Facey, which is a family member of the Providence group as well, health system. And we're really happy that we have a guest from our Facey family with us today. We'll introduce very shortly. But I want to go over some just general work here to make sure that everyone is well informed. One, listen, if you want to really pick up this KHTS, especially anywhere you're going, you want to make sure you download the app. You can find us on 98.1 FM. You can find us on 1220 AM. There's really no excuse why you can't find us. And even when you're driving into the valley, maybe to come visit us over at Holy Cross, not a problem, especially with the app and with the FM station. So really glad to be here. Special thanks, of course, to the KHTS family for allowing us this opportunity every third Wednesday. And, gosh, let's talk about what's going on. It's busy. Holy Cross is really busy. And just recently, they just announced that our institutes, we have these pillars of areas of care that we offer through the Providence Health System. And one of the ones I'm proudly a member of is the Orthopedic and Sports Medicine Institute. With the joining with St. Joseph's Health down in Orange County and in some of the other states more east, we've actually made some adjustments to a point where my boss, Patrice Halleck, who is the regional director of orthopedic and sports medicine, is not only just taking a look at the valley, is not only going down into the South Bay, but now she's actually extended her reach into the Orange County area and beyond. So she is actually overseeing all of Southern California. And similar things occurred in our other institutes as well. And we really recommend, come on into Holy Cross. Talk with some of the staff, talk with the foundation. If you see a lot of the work that we're doing, and it seems to really, meld with your values, your mission in being able to assist, we would love to be able to have you be a part of the family as well, and helping out where you can. We've actually instituted Providence in the Santa Clarita Valley, and an offshoot group of the foundation here in the Santa Clarita specifically, working with those individuals to see how we can better support Holy Cross in their efforts. And I believe we should be seeing relatively soon some information coming out for an event we're going to be offering at the beginning of May, where we're actually going to have the director of our neonatal ICU going to be coming out to Santa Clarita to be able to speak to anybody who would like to go to find out more information, one, about what all we're doing with the NICU, but not only that, but how they can help, because what we're really looking for is we're looking to expand. We need to be able to get another 4 or 6 beds, I believe, is what the goal is, because we're running at full capacity all the time. And part of what Holy Cross wants to be able to do is we want to be able to meet the need of their communities. And it's no longer community where we originally were just a San Fernando Valley-based hospital. But with the growth coming out to Santa Clarita, we need to grow to accommodate the need. So we'll look more for that. I believe Rick Ferrante's show, which occurs on Monday, roughly around this time, he will be giving more information on this. And as I get more information, I'll bring that up as well. And just to kind of go through it, and this isn't just for radio where I'm wiggling paper, but it's actually information on here. You can see us on Facebook Live. Coming up this Saturday, which is one of the reasons why I'm really pleased to have our guest, and we'll get to you in you're like, I'm ready to go. The Santa Clarita Valley Concussion Seminar. Now, we find concussions to be so darned important, especially for the health of our youth and as our youth continue to progress into adulthood, that we are putting down our brand, if you will, and people from Kaiser, people from Henry Mayo, people from Providence, people from Facey, people from our local high schools, people from COC, we're all getting together and we've created a concussion consortium, a large group of people, and SCOE, I don't want to leave them out as well, that this large group of experts, if you will, are going to be seeing what they can do in order to assist not only just the youth, but everybody as far as how to, one, if it's possible to avoid concussion, two, how to be able to be better cared for that. That will allow people to have a much better quality of life, a safer return to activity. And we can't be any more excited that this Saturday, we're going to be having, I believe, our Concussion Consortium's first seminar, which is being offered not only to the general public, but also to the coaches, athletic trainers, any physicians, nurses, and physical therapists, anyone who might be interested in learning more about more up-to-date information regarding concussions. We're offering this seminar. It's going to be starting at 8 o'clock, and it's Saturday, February 24th. And for those who know the area pretty well, it's going to be at the Henry Mayo Fitness Center in their lecture area. And if there's I believe they're going to be serving a continental breakfast, I think. And but we do want to make sure that people RSVP. Okay, now I believe that RSVP date might have passed. They wanted it at the 16th. However, I'm going to throw you a phone number anyways: 661-200-2300. That's 661-200-2300. And that, give them a call. Ask them if there's still room, if they can be able to accommodate any more guests to be able to come in and learn more about concussion amongst a group of experts. We have invited guests coming out, but more importantly is realize that normally Holy Cross and Providence wants to stick with Providence stuff. Henry Mayo wants to stick with Henry Mayo stuff, and Kaiser wants to stick with Kaiser stuff. This is actually a really big deal. You have three very, very strong brands coming together for the betterment of the community. So because of that, it only made sense to go to a sports medicine expert, all right? And within our family, within Providence at Facey Medical Group, Dr. Usman took some time away from clinic. Thank you very much for arranging your patience, because it was a little bit short notice, to be able to come in and join us on air.
Thanks for having me.
Absolutely. Now you know, his CV is quite extensive for all the things that he's had the opportunity to be able to be a part of. The big piece for me is, you know, having trained a lot of your sports medicine residency back in the Midwest, it sounds like, but the variety of sports that you've had the opportunity to be the physician for is significant, and I think allows you to be a little bit better well-rounded as well. But before we ever even get into the actual sports medicine piece, you know, what drove you to medicine?
Well, you know, growing up, I was playing a lot of sports. I played soccer almost at a professional level, but I had a couple injuries, and there weren't really too many, you know, sports medicine doctors around at the time. So it wasn't like a surgical issue. So it's kind of like you see your family doctor, and that's kind of it. So if you happen to have somebody who's interested in sports, they knew, you know, what was going on. They took, you know, kind of closer look at it. Otherwise, you're kind of on your own. Can Google and stuff like that. So that kind of drove me to search, and I found that there is a field that is actually dedicated more to sports,
Right,
and musculoskeletal medicine. So I'm actually board certified in both family and sports medicine. So that kind of gives me a whole body approach, not only just to your injury, but, you know, I can look at, you know, if you have any other underlying diabetes or heart problems, something else that could be affecting your injury risk and your recovery.
correct. And the approach for sports medicine, though often tied to athletics, though it also works for occupational related issues, because occupational related issues they're occupational athletes. So it doesn't necessarily mean only with athletics, but could also be for that weekend warrior. It could be for that occupational warrior. So it isn't completely limited to only those who are in competitive sports.
Absolutely. Like I say, at least half or more of the people I see are the weekend warriors or people who got hurt on the job. My philosophy is if you're moving, you're an athlete.
Right.
You have joints, you have the same muscle and tendons as the athlete. You may not need it at their level, at an elite level, but you still need a level to, do your job, do your enjoyment on the weekend, what have you, play with your kids, whatever it may be, will get you back to the level that you need to be.
Yeah, and I totally appreciate the fact that you said that oftentimes, depending on your physician, it may or may not be, they may or may not have a desire or drive to work with the athlete, and that actually can direct how that care would be. And I'll share with you, when I was a kid, my pediatrician was a great guy, and he was Austrian, and I was soccer as well, and baseball. And luckily, at my height, you can't see it on Facebook, but at my height, I grew really fast. I had Osgood Slaughters, and he said, not a problem, just wear ace wraps on your knees, and you'll be able to go back and play soccer. And I said, well, what about baseball? He said, you should not go back to baseball. So it's sports specific sometimes with these physicians as well. So I just wanted to share that, but pretty darn funny. And so did you start off thinking that you were going to go into sports medicine, or did you just go with and then decide sports medicine was the direction after you finished your family practice work?
Yeah, I actually started out in general surgery, and then kind of midway through, I realized this wasn't for me. And I was still looking at the sports angle, and sports medicine was kind of gaining popularity at the time. So that's why I switched to the family medicine residency. But I knew going in that I really wanted to do sports after. So then I did my fellowship in Kansas City, and then here I am.
That's perfect, and just because sometimes there's a little bit of confusion when you talk with an orthopedist who has did their sports medicine fellowship. Usually, the sports medicine fellowship in orthopedics is more based towards surgical approach, to minimally invasive, to allow for quicker return, as opposed to in family practice. As you said, it's a full body approach.
Yes, not a majority of injuries, I'd say, are non-surgical, and there are various techniques you can try out, like physical therapy. Some people do acupuncture. But with the use of an ultrasound machine, I can even kind of look, and we could do injections. We can do like dry needling, PRP, which is platelet-rich plasma. Several different modalities out there that can kind of avoid surgery, because a lot of things don't need surgery. Obviously, if you've torn your anterior cruciate ligament, then yes, if you want to return to sports, you most likely will need to have surgery.
Unless you're that lucky 10%.
But yes, unless you're, or maybe even less than 10.
Maybe even less than 10. Recently they just came out with some research that indicated that there are specific people with specific looking knees that even with a torn ACL might be able to go without surgery and still be able to return to sports. But those are a very, very specific group of people. So So, we didn't come in with an agenda today, and you said something very interesting, and it's something that we really haven't spoken about in any of our shows yet, and maybe we'll start off there, is I saw it mostly in the media, probably, when was it when Hines Ward won the MVP, and he had PRP injections for his medial collateral ligament injury, that he had a grade 2 sprain, meaning it was a pretty significant but not a full tear for those who are listening. But he had a PRP injection and then played in the Super Bowl and was able to be MVP within a week after the injection, on an injury that had occurred a week previous to that. Let's talk about PRP. So what is PRP?
So PRP stands for platelet-rich plasma. What it involves is we take some blood from the patient, and you spin it in a centrifuge, and you would concentrate growth factors, among other things, and then you re-inject it back into the area of injury or inflammation, with the goal that that's going to sort of calm down the inflammation and promote healing, without the side effects of like a steroid or like cortisone injection that people get. And it's actually shown really good results for not everything, but most things, especially for tennis elbow. We've seen great results. Has been shown time and again to be better than a cortisone shot for that, and longer results.
Right. And then is there any, so once you receive the injection, now you mentioned something about ultrasound guidance. A lot of times you might also, fenestrate the tendon while you're in, depending on what the injury is. And then that ultrasound will actually be able to demonstrate the void or the area of injury. And then, is there a follow-up to that? Is there a specific time frame where you'll do maybe redo imaging just to see how everything is progressing, or any type of an expectation or anticipation?
Yeah, I mean, it just depends. Yeah, with the ultrasound, it has both diagnostic and therapeutic uses. So while I'm doing the procedure, I would use the ultrasound machine to make sure I'm in the right spot. I can visualize, muscle tears, any inflammation, damage to ligaments, etc. And then you can kind of inject right there. And then you could, because you save those images, you could follow up with a repeat ultrasound in 4 weeks or so to check it out. But usually I see those patients back in 2 weeks. And, there's certain restrictions like avoiding any anti-inflammatory or ice during the initial 2 weeks at least. And then when you see them back, kind of see how they're doing. Some people need more than one, especially if there's like arthritis or tendinitis. Sometimes you need to space them out.
Okay. And then is there it's a loaded question because I wrote the protocol for another organization I was at, but as far as the rehab afterwards, for a lot of these injuries, it's based towards soft tissue restructuring, things to that extent. And do you find with your patients who go through PRP and going into physical therapy after the fact that you're noticing that there are some gains as well?
Yes. I mean, most of the people who are coming to get PRP, they're usually pretty motivated. It is usually not covered by insurance, so they have to pay out of pocket. So when they're paying out of pocket, they're usually more sort of willing to follow instructions. So physical therapy, with or without PRP, is great. I'm a strong believer. I've done it myself. So yeah, if they follow through with the protocol, and I've spoken to some of the local physical therapists on what I'd be looking for after like a PRP injection, depending on where it was. And yeah, if you don't do the physical therapy, that's like sort of half the treatment.
Right. And then do you find that specifically where a lot of the sex in your practice, but also in the research, are there certain injuries that are commonly treated with PRP where there has been demonstrative success?
Yeah, I mean, you could use like for tendinitis, so like overuse injuries, patellar tendinitis. You could use it for at the elbow, like tennis elbow, golfer's elbow. It's not really yet been shown to be great for complete tears. So like if your rotator cuff is completely torn or ACL, but they're still studying that.
And there is something to the use of PRP or maybe even stem cell, or one of my colleagues who was doing the graft jacket repairs on rotator cuff, where the crimson duvet, where they'll allow some of the marrow to go ahead and escape, because it allows for, after the repair, you can actually get a surgically stronger repair.
Yeah, they've used to do that. Actually, I've had knee surgery, so I had a microfracture, which is similar to that on my knee, and didn't go well. But they're still studying that, so maybe you have better results than the shoulder.
Correct.
Yeah.
Well, hey, you guys are joining us here on KHTS on the Providence Holy Cross Health Hour. We're with Dr. Usman from Facey Medical Group, sports medicine, a primary care sports medicine specialist. And we're going to be kind of going into, after the break, we're going to start delving into maybe with youth sports and maybe take a look at specialization, because that seems to be a really kind of hot topic and continues to be a hot topic, especially as we get into the baseball time. Where we see an awful lot of injuries. And Dr. Andrews has spoken quite significantly on these types of problems. And really looking forward to getting into that. You're joining us here on KHTS, your hometown station. We'll be back really soon.
Santa Clarita Philharmonic has begun its season of free concerts. The SCP is a non-profit community-based volunteer symphony orchestra comprised of local musicians from throughout the Santa Clarita Valley who are dedicated to providing quality classical music for the residents of the Santa Clarita Valley. Like the Santa Clarita Philharmonic on Facebook or visit santaclaritaphilharmonic.org for more information.
Your building sign is essential in getting customers to your location. Feathers can help get your business noticed. They walk you through each phase of your building sign project, providing special attention to detail and quality. Feathers will give you a sign you can be proud of. Your building sign will draw customers in instead of having them drive by. Feathers on Soledad in Canyon Country, across from the Edwards Theater. Or go to feathersphoto.com. That's feathersphoto.com.
Want to go back in time to the days when a restaurant meant a place where families gather and friends meet? Try Telly's, now serving comfort food that will warm your heart and soothe your soul. From mouth-watering old-fashioned breakfasts and dinner specials that will make you feel like you're at home. The original Telly's Char Burgers up bouquet just past Haskell. Try Telly's, now serving comfort food that will warm your heart and soothe your soul. Food, family, friends. What better way to share a meal?
Santa Clarita's hometown station. Hometown station.
KHTS AM 1220 and the new 98.1 FM.
Doctor, doctor, give me the news. I've got a bad case of loving you. No pills gonna cure my...
And welcome back. You're joining us here on the Providence Holy Cross Health Hour on KHTS, your hometown station. Finding us on 98.1 FM, 1220 AM, and also on the app, which you can go ahead and download both for your Android and for your iPhone. And, you know, we're pretty happy to be inside on what seems to be a pretty darn chilly day out in Santa Clarita. And we're being joined today by one of FACES Medical Group's own, their primary care sports medicine specialist, Dr. Usman. And I really appreciate you coming out today to be able to join us. And the impetus on this was because of our concussion consortium having our very first seminar coming up at the Henry Mayo Fitness Center on this coming Saturday. But, you know, before we went to the break, we were talking about PRP and the fact that it is being found to work with a number of different overuse injuries, tendinitises and such. And we do know that it is being used during surgery on occasion. I know it was being used often for spine surgeries, especially if there were fusions and things, and even as you found with the knee and with rotator cuff and such. So, but we wanted to kind of impress upon that, again, this isn't something that normally insurance is going to cover. Is that right?
Yeah. Here in the U.S., I don't think that there are really going to be many or any insurance companies that cover the PRP, so it's usually a cash payment. In Europe, however, it is covered to some extent, but they've been using it over there for much longer than the U.S., so
Correct.
That might be part of it.
That's probably is part of it. And that anytime you're taking a look at certain types of injections of body product, whether it be a PRP or even stem cell, a lot of the times that is going to be an out-of-pocket type of an expense.
Yes,
Okay.
definitely.
Okay, so I just want to make sure because I didn't want anyone to listen to the show today to go immediately to the doctor and say I want to have PRP and those guys on KHTS said. So we just want to make sure we get the right information out there. As we were leading into the break, kind of teased the idea of sports specificity, and for those who aren't quite sure what that means, and it seems to be I'd probably say over the last 15 years or so, maybe a little bit longer, what we're finding is a lot of our youth are being specialized in specific sports that they are actually playing year-round, where maybe 20 years ago, the kids were actually playing multiple sports. So they would play a season of baseball, and they'd go off and play soccer, and maybe from soccer go to basketball, and basketball back to baseball. And the reason why this is starting to become a little bit bigger of a deal is injuries that, one, were so rare to see, and I will liken it to, we'll talk about baseball, just because this conversation seems to always crop up, especially in the middle of the season, especially when maybe one of the new draft picks is going in for Tommy John. And I can say in practice-wise for myself, before, 20 years ago, we didn't see these injuries, and if we did, it was usually going to be an adult. But now I can tell you, before I stopped my primary practice, I had 3 people being treated at the same time for Tommy John repair, who live in Santa Clarita, and were under the age of 20, and it seems to be becoming more prevalent. Is that what your experience is as well, that we're starting to see a lot of these overuse in much younger patients?
Yes, definitely. Kids are playing year-round, not only for their school, but they play for a travel team as well. So it's like 6 days a week, and most of the time it's 12 months a year. So they're not taking a break, and usually just be one sport. So, little Johnny, he's just playing baseball, and he may be a pitcher, he may be a outfield player, but that's all he's doing. and he's not really cross training, getting strength or developing other muscles besides what he'd use specifically in baseball.
And just generally giving the body that little bit of a break.
Yes, I mean generally you want to every 6 months take a month off completely from sport, and you really don't want to be doing 6 to 7 days a week and not giving your body a chance to recover. And these are in kids. They're growing. They're still developing. Just developing an arm to throw with, or playing soccer and you're just kicking a ball. You're not, 6 days a week. You're not getting any rest, and you're also not cross training. So cross training helps develop other muscles that will help, prevent overuse injuries, which is what we see primarily with the specialization. So yeah, I mean, definitely it's a growing problem. Sports medicine community done a lot of research on that. I've done some research on it too. But yeah, it's definitely a problem.
And then, so what we're talking about is when we say the word overuse, a lot of the times what we're saying is that you might use a body part, and then physiologically that body part will go through its usual phases. It will recover to be able to use again. But oftentimes what we find is for the people who are specializing that they aren't offering their body that opportunity to recover. They continue. And so they never actually have that body part never has that opportunity to be able to recover completely before it's being used again. And those types of micro injuries, if you want to call them micro traumas, have a tendency to build up.
Yes. If somebody's playing a sport and they break their arm or they have a dislocation, that's one thing. But what we're seeing is, somebody's playing a sport and over time develop shoulder pain or elbow pain, and then this becomes like a chronic thing. They're sort of pushing through it because kids really can't tell the difference between muscle soreness from overuse or actual pain from an injury. And then by the time they come in, then it's like, okay, you got to take a month or two off. The pain's got to go down because they're not only are their muscles being overused, but they're developing. So they're growing in size, they're growing in strength. So everything's kind of changing at the same time. So yeah, you have to give them plenty of rest. Along with activity, there's got to be rest.
Right, and I'll tell you that baseball, mine was an overuse injury with my shoulder, and it's interesting that we want to still play. All right, we don't want to be taken out. We want to continue to play, and so we'll do whatever is necessary to ensure that we can continue to play, which also then creates the problem of compensation, where now all of a sudden you start watching somebody's actual technique change to try to accommodate another body part that's sore. And sometimes those problems will compound over the long run, allowing for those overuse injuries to continue. And do you see a lot of that too, where they start making a lot of different adjustments, which just, it seems to be like a snowball effect?
Yeah, I mean, you mentioned Tommy John in the beginning. That's what happens. A lot of times the pitcher will start having shoulder pain, and then as a result, they change their technique or they want to gain more speed and control. They start loading up their elbow, and then one day the elbow just kind of gives out because it can't handle the load. But you see that in all kinds of different ways. You could have hip pain leading to more knee pain, and then the knee pain sort of takes over. And yeah, I mean, then you're just out for weeks, months at a time, and that's really hard for a kid and a lot of times their parents and coaches to understand as well.
Correct. Yeah, that shin bone connected to the knee bone. Whoever wrote that, and I don't know who wrote that. I probably should look that up. The guy's a genius. I mean, that's like a general kinetic theory for most when it comes to sports medicine. You mentioned something really important. The parents and the coach in trying to allow them the opportunity to be able to gain a better understanding of what this overuse is. Because oftentimes it's going to get in the way of their child's ability to maybe go to a showcase, to be able to, you don't want to show injury because they don't want to be scouted incorrectly. Those types of things. How do you have that conversation with the family and or the coach?
Yeah, I mean, it's a really difficult conversation. A lot of times by the time they've seen me, it's like, well, the tournament's 2 weeks away and his arm is hurting when he's sleeping. So it's like, it's really hard to do anything acutely. A lot of these, especially in growing kids, that rest is it. Time is the greatest healer. So you just kind of have to wait because you can't start physical therapy or loading or strengthening until they're pain-free and they can just do, range of motion when they're not playing.
Right.
So yeah,
Right, and then the other piece of it too is it used to be RICEM, rest, ice, compress, and elevate, and rest was usually full body rest. But now we're modifying that a little bit where it should be more focused rest. So where you may have little Johnny, he seems to be a pretty popular patient. Little Johnny comes in with a bad shoulder, maybe a little rotator cuff tendonitis from overuse. Now what we're going to do is we may put them on no throwing, but maybe we'll allow them to continue running, allow them to continue doing core work. So we don't want that athlete to decondition either. And so, are you experiencing that now with the practice that the kids they're starting to become a little bit more receptive to the idea? Okay, so I can't throw. What can I do in the meantime? So that they don't have that big down period as they try to ramp back up, or if they become so deconditioned where fatigue actually ends up being a problem. Do you find that conversation is starting to happen some?
yeah, definitely. I mean, throughout my career, I've always felt that just because your arms hurt doesn't mean that you can't jog or sort of try to do some leg exercises and vice versa. But lately, the research also is showing that psychologically, athletes suffer quite a bit. So. If you have a knee injury and I tell you can't do anything at all, just sit. So you go from 5, 6 days a week of working out to nothing. That's going to be hard to take. But if I tell you that, your arms hurt, you can still do some cardio with your legs. You can do some leg workouts or the other way around. At least you have something that, you can still be involved with your team, still go to the weight room, still kind of be there without actually playing while you're recovering. And I think that's the way to go.
It's the sagest of advice. That I appreciate you saying that. One of the things I know with Holy Cross, with Providence, is we'll be instituting. I was sharing with you off air that we're going to begin working with some of our local high schools, as well as with some of the organizations, with the hope of trying to create a type of a program that allows for the greatest of communication amongst everybody. So that way that understanding of where a person is will be shared amongst everyone, not only with the athlete, but with the family, with the parents, with the coach, with the rehab staff, with the physician staff. So that way kind of everyone can kind of stay on board. And a lot of times it's communication that is a really big deal when it comes to handling athletic injuries.
Yes. Like fear of the unknown is, seen by everybody. So if you don't know what's wrong, it's really hard to understand and to sort of visualize when you're going to ever be back. So explain to the parent that, okay, this is the injury, this is the time frame we're looking at. That always helps. And that's kind of how I've always gone about it. Mm-hmm. And a lot of times coaches want to know. So without actually, sort of giving out protected medical information, you can still give out like a timeline. Like I expect him to be back to throwing in maybe 3 weeks or 6 weeks, and then during this time he can condition with sort of the following limitations. So that at least gives the coach something to work with.
Which is nice, and then for those who don't know, I mean, the list of sports that Dr. Usman's had the opportunity to be able to work with, most notably what my eye caught to immediately was with DC United. That conversation, and it was funny because we were talking about this, it's something I was covering this weekend, the conversation between the physician, the athlete, the coach, and the owner, that's a tough one, right?
Yes. I mean, I haven't really had to do any interactions with the owner, but when it's hiring or signing a new player, they have to undergo a physical. A big part of it is, are they medically fit to play? Same thing with if your star player goes out or anybody. It is a team sport, so any one player goes down, obviously the question is, well, what's going on? How soon can you return? So you definitely have a huge role to play there. So a lot of times it comes to tempering expectations.
No pressure. No pressure at all. I remember seeing someone who was played with the Milwaukee Bucks, and they had failed pretty much all treating, for 10 months, and they finally flew him into California to get worked on, and we had the opportunity to treat. And the doc actually said, he said, well, so how long, what are we looking at? And I said, well, normally we were using extracorporeal shockwave therapy for this gentleman. And so I said, well, normal protocol is going to take about 3 weeks. Well, that 3 weeks, his mind shut off. And then when I sent our plan of care back to the trainers with the Bucks, I get a phone call with the trainer, with the owner or the GM in the background screaming his head off. It says 5. You told us 3. It's got to be 3. Oh,
Yep.
my God. That's no pressure.
Yep. Everybody's under pressure. So
Unbelievable, absolutely unbelievable. So that those conversations actually exist, and now that we're in an Olympic time right now, it's really interesting to be able to have the opportunity to see every time you see a red shirt or red jacket at any of the venues. Oftentimes, that's going to be the medical staff, whether it be athletic trainers, physical therapists, physicians, medics, paramedics. Just kind of keep an eye on the background. They're everywhere, especially like with short track speed skating. You're going to see one probably every 20 yards or so in and around the ring just to make sure that everyone's going to be safe. And so sports medicine is becoming much more prevalent. And it's going to be a much bigger deal. And as we find more and more, there's surgery where necessary. Conservative care seems to be the initial let's see what we can do type of thing. And that's where you're going to really come in.
yes, yeah, that is primarily where I come in. And a lot of times patients can't have surgery for medical issues or the time isn't right. So it's like, what can we do in the meantime to kind of allow maybe to play or to just be active and to live their life?
Maybe to medically optimize or however.
Yes.
Yeah, that's a really big deal. And one we'll probably have a show sometime in the future where we'll actually talk about medical optimization. What that means is that person who might be overweight or their diabetes may not be well controlled or their blood pressure is not well controlled. Those patients normally are going to be a little bit more difficult in the surgical field, in the perioperatively. And so we want to make sure that the patients are the healthiest coming in for surgery, especially for those elective cases, because we're going to find we're going to have better success.
Yes.
And that is something that you would actually help with.
Yep. Yeah. As far as sort of exercise capacity, but it's a team approach. You kind of have to talk to the surgeon, you talk to the family doctor, you talk to primary care sports medicine, and then after surgeries with the physical therapist. So it's a big team approach, and the goal is to get them back out there healthy.
It's a great goal. Now, we're going to totally shift gears just a little bit, just because I know we have a few minutes before the segment finishes up, and we want to make sure that we. Let's just talk briefly. We're out of football, okay? I know that there is still some soccer going on. But we've got the class coming up on Saturday over at the Henry Mayo Fitness Center, starting at 8 o'clock, where we're going to actually be giving a concussion seminar. And you've been a key role, a key person in that group, the Concussion Consortium, in allowing for something like this to occur and making sure that we're giving the most up-to-date information. Just let's maybe talk a little bit about maybe signs and symptoms of a concussion. What would we expect?
So, usually you see it like on the sideline of a game. I'll be there, see somebody. So it would be that you have to go through there's a series called a SCAT test. You kind of go through a number of questions, check their memory. They'll have difficulty. They may not know the score of the current game. They may not know what half it is. They may not know what position they play or who they're playing against. These are quick and easy questions you can just ask on the sideline. Other things, they may not be able to walk in a straight line. They may be feeling disoriented. You don't want to use terms like that their bell got rung and stuff like that. We're trying to get away from that.
Right.
But you do want to definitely check on both their physical and their mental capacity to return to a game. So if you have any suspicion, the rule is they don't return that day.
Correct. And that with that, there is a series of things that should occur afterwards, which can include not only just physical rest, but they're also talking about mental rest as well.
Yes, mental rest is a huge component. In today's day, with so many screens out there, screen time should be limited or shut down as much as possible. But also, a lot of people are working, or they may have tests coming up. So you can write. There's notes to give to the teachers that they may need more time. They may need to take tests at a later time after they've sort of recovered from their concussion symptoms. But yeah, that's
perfect. And so we're taking this much more seriously.
Absolutely. Concussions are no joke. They're real. They occur. and I've been seeing a lot of them throughout my career so far. And yeah, if you don't take care of them, they can last for a long time and interfere with your whole life.
Correct. Now, and we're doing some baseline testing now with the hospital. We came up and took care of the hockey team up here in Santa Clarita to do a lot of the impact baseline testing. And my understanding is you're in the process of impact training for certification?
Yeah, I mean, I know how to interpret the test. I haven't gotten formal certification yet, but yeah, that should be done shortly.
Perfect. So I know we're going to be hitting a small little break. We're going to come back. We'll kind of wrap things up for today, but also want to make sure we give out the most important information is how you're going to actually reach Dr. Usman to make sure that you're getting the best care for any needs that you have that he's going to be able to assist with. So you're on KHTS, your hometown station, with the Providence Holy Cross Health Hour. See you soon.
Why do people from all over Santa Clarita come to our spa in Canyon Country? Simple. They want the highest quality services at prices that everyone can afford. This is Rosemary from Beyond Harmony Med Spa. Read our reviews and know why we won the Ultimate Beauty Awards 2 years in a row by the readers of Elite magazine. Come and see how close we really are and experience the level of excellence that our clients have loved for the past 13 years. Go to beyondharmony.com or call 298-8008 today for a free consultation.
The Santa Clarita Artists Association has a new gallery in downtown Newhall on 6th Street between Main and Railroad, right across from the Canyon Theater Guild. The gallery features our members' paintings, sculptures, and one-of-a-kind handcrafted gift items. Whether you're an art lover, buyer, or an artist wishing to join, visit our website at santaclaritaartist.org, come to our free monthly meetings at Barnes & Noble, or stop by the gallery. For upcoming events and exhibits, check us out at santaclaritaartist.org. We make visual art visible.
Men, are you feeling tired, stressed, or just don't have the energy you used to? Did you know this could be related to decreased testosterone levels? Luckily, there's a safe, effective solution. Weeder Prime helps support healthy testosterone levels with clinically tested key ingredients. Just 2 capsules of Weeder Prime each day can help change your mood, energy, focus, body fat, and lean muscle. Feel the way you felt 10, 20, even 30 years ago. Rediscover your Prime with Weeder Prime. To find a retailer near you, visit WeederPrime.com. That's WEIDER Prime.com.
Hey there, I'm Tori with your hometown station weather. A mix of sun and clouds this afternoon with highs in the upper 50s. Clouds overnight with lows in the 30s. More of the same for Thursday and Friday. Lent is here and St. Clair's is holding their Lenten fish fries. Dine in or take out. Proceeds benefit local charities and families in need. For more information, go to hometownstation.com.
Your hometown station.
KHTS AM 1220 and the new 98.1 FM.
Doctor, give me the news. I've got a bad case of loving you.
And welcome back, Santa Clarita. You're joining us here on the Providence Holy Cross Health Hour on your hometown station, KHTS, which you're going to be able to find very conveniently at 98.1 FM and 1220 AM. And on the KHTS app, which is very easily readily available. I'll throw a few more adverbs in there. For your iPhone, as well as your Android. You also, if you happen to be on Facebook, you might see our faces on there right now, which could be fortunate or unfortunate. But we would really appreciate you joining us today. We have Dr. Usman from Facey Medical Group, Primary Care Sports Medicine, and as we left for the break, we were talking about concussion. Part of it because we have that big concussion seminar coming up that I know that both of us are part of the consortium in putting this seminar on. And of most interest is that we mentioned before we broke on how significant and why we're taking it so seriously. I will say it's so serious that it got Kaiser, Henry Mayo, and Holy Cross and SCOE in the same room at the same time for the same goal, for the safety of kids. That's how important this is, right?
Yes, it's a big issue. I mean, you hear more about concussions. I don't think it's because they're occurring more. It's just because people are recognizing them more,
right,
and realizing the seriousness of it and that it's a real thing.
It is a real thing, and I think since both of us were covering football in a variety of sports now on the sidelines, I can tell you when I first started covering football, we might have one concussion every other game, or at least that was made aware of us, to me at least. By the time I stopped covering football 20 years later, it was probably 3 to 5 a game. And one of the pieces that I did find is that there is a technique piece to this. I mean, tackling techniques and things to that extent, that it would almost, there's a training piece that maybe there might be less technique and maybe more highlight reel that at least that's what I was recognizing with my last couple of years. Did you come across anything like that?
Maybe. I mean, we haven't really identified how to prevent concussions. So, helmets, neck strength, mouth guards, changing tackling techniques. Not been shown definitely yet. If there's anything really great out there. Maybe a little bit of weak research on neck strength in younger kids. But apart from that, we haven't seen anything for concussions. But yes, I mean, doing like spear tackling and stuff like that, that can lead to other, even bigger injuries like your C-spine getting
neck
damaged, paralyzed, that kind of thing. So.
Right. So the I think one of the pieces that one is recognition. We need to take this seriously, that oftentimes there is a level of physical as well as mental rest that is required to appropriately recover. Are there dangers if maybe they decide that they're going to not tell somebody that they suffered a concussion and getting repeat concussions?
Yes, I mean, usually what we see is if you've had one concussion, you have a higher chance than somebody who hasn't to have it again. And then usually subsequent concussions do tend to last longer. And there's no definite period. It could be concussion lasted like a week or two, it could go months. Some people have sort of some small symptoms left over for years.
Correct.
And they don't ever completely resolve.
Right.
So, but the biggest thing about concussion is if you have a concussion in a game and it's not identified and you go back, that's where we see second impact syndrome. People have died.
Correct.
And that's the biggest sort of side effect, if you want to call it that.
Right. Significant. And that's the reason why we really want to take these things more seriously. More so now than we keep hearing in the news about a lot of the athletes who, they finish their career and they're in their 40s and the 50s, and they're dealing with an awful lot of problems or dying. And as they're doing assessments of their brains after the fact, they're finding that there are significant changes that have occurred in the brain that presently we're not able to test for yet.
Right. Yeah. I think you're referring to CTE.
Correct.
Chronic traumatic encephalopathy. I mean, they haven't gotten an exact link yet to concussions or the number of concussions, but there is a thought that that's what it is. So there's quite a bit of research being done at multiple levels. So let's see what that brings out. But yeah, I mean, it wouldn't be surprising if there is a link there.
Right. So I'll tell you, it's going to be really, really important for everybody to make sure that you, especially if you have yourself are a weekend athlete or are an athlete, if your children are athletes, or participate in sports, participate in life, participate in activity, that you want to make sure that you are building your team that will allow you to, one, prolong your enjoyment, to progress your skill and prowess, if you will, to further levels. In Santa Clarita, if you're not aware, I know you're non-California, so the Santa Clarita specifically, at one time, Hart High School had people who played on the same team. I believe there were 5 or 6 playing at the Major League Baseball level at the same time, all coming from basically the same class. Which, I mean, odds are so against that. Santa Clarita does bring an awful lot of athletes through, so you are absolutely in the right place at the right time. But how do we reach you?
You can just call my clinic. The number is 661-481-2400. And anybody can make an appointment. You don't necessarily have to be part of HMO.
Perfect.
We accept, I think, most insurances. So
Right.
Yeah, give us a call.
And you're with Facey, and you're over on the new Facey building on the Henry Mayo campus?
Yes, it's called the Valencia Specialty Building. So it's right off McBean,
Okay.
right on Henry Mayo's sort of campus grounds, yeah.
Perfect. And then, so you do not need to be a FACEI member as an HMO. You can actually go with it as a regular insurance, standard insurance. They can make that appointment with you. But if they are part of an HMO with that is being cared for by FACEI, then they should...
They just need to get a referral from their primary care doctor, regarding whatever injury they may have.
Perfect. And I'll tell you, one of the nicest things about, now FACEI is on Epic. Sorry. That's been its own little problem. That's the electronic medical record. And the nice part of that is now everyone, once you're in that FACEI group, everybody who's involved in your care will have access to that entire record all the time. So that really improves communication.
Yes.
Well, I'll tell you, it's been an absolute pleasure having you on. The first we've met, not the last time we're going to meet. And thank you very much for joining us on air today. I appreciate KHTS for allowing us the opportunity to be able to come on air every third Wednesday of the month. And I want to appreciate everybody who is out there listening. You've joined us here on the Providence Holy Cross Health Hour on KHTS, your hometown station. We'll see you next month.